Streaming now, this is the Wood TV Live Desk.
And good afternoon, everyone. Phil Penarski here with the Wood TV Live Desk. Hope you're having a great day so far. Joining us today is Dr. Natasha Bagdasarian with the Michigan Department of Health and Human Services to talk about the recent cases that we have seen of the measles in the state of Michigan and really across the rest of the country. Dr. Bagdasarian, thank you so much for being here today.
Thanks for having me on.
Of course. And, first things first, I really want to get into the conversation right away on measles. There have already been 3 cases reported in the state of Michigan, more so on the east side of the state. These are the first cases we've seen in Michigan since 2019. And my first question is, are we potentially going to see more? I mean, is this maybe a trend that you guys are kind of monitoring at MDHHS and just seeing how maybe we see even more maybe all throughout the rest of the state? Is this something that maybe could be mitigated? Are we potentially reaching the point of maybe even a possible outbreak of measles here in the state?
Well, I'll start out by saying that there have been outbreaks around the country in other states. And so this is something that we have been following very closely. We've been asking people to get vaccinated, and we have been warning about the possibility of outbreaks here in Michigan. Now, if we go back a little bit, back to before the COVID-19 pandemic, we had already started seeing in 2019 an uptick of measles cases around the globe. And now, as those measles cases went up, our vaccine rates were still pretty robust in 2019, or better than they are now. And during the pandemic, of course, there was not a whole lot of travel. Folks were socially distancing and wearing masks. These are all things that also mitigate against other infectious diseases. And so we did not see cases of measles here in our state for those 3 years. Now, of course, people are traveling again. People aren't taking those kinds of precautions, and those global cases of measles are again elevated. And now what we're seeing in our state is that vaccine rates are slightly down. We are not at the threshold we need to maintain herd immunity for things like measles. And so with the increased measles cases overseas and in other states, it really puts us at risk. And so we are monitoring the situation very closely.
Mm-hmm. And I kind of want to shift over now to just talking about the disease in general. As I mentioned, these are some of the first cases we've heard since 2019 here in the state of Michigan alone. It's really not a disease that we spend a lot of time talking about here in the newsroom or really anywhere that we really hear about. So some people may not even be familiar with really what it is. Can you just talk about some of the major dangers associated with this disease?
Yeah, happy to talk about that. Measles was something that was very, very common about 50 or 60 years ago. Now, we've had a vaccine since 1963, and so the rates of measles since the 1960s have gone down significantly. And in fact, many doctors and healthcare providers have never seen a case of measles because it has been so uncommon here in the United States. It was, in fact, declared eliminated in the United States in 2000. Now, that doesn't mean that we haven't had any cases. It just means that it was not something that was still spreading widely in the US. So we haven't been hearing about it. But before we had a vaccine, if we go back, say, 80 years or 100 years, about 500 people every year in the United States would die from measles. Now, measles is a disease that causes high fever, cough, runny nose, red eyes, all sounds fairly nonspecific. Later, a rash begins and starts at the head and works its way down the body. And the issue with measles is that some of the complications of measles can be very severe. So people can end up with encephalitis, which is a swelling around the brain, pneumonia, which can be pretty severe, and people can even die from measles.
And Dr. Bagdasarian, for people that are maybe a little bit worried, or maybe, as you mentioned, those kind of early warning signs associated with measles, maybe they're feeling some of that, and maybe hearing about the measles cases is starting to get their paranoia up a little bit, or maybe they're wanting to check it out. Well, I mean, what are some of the things that they really need to keep in mind for them to know, hey, I need to go to the doctor now, and really when is that sort of point when this turns from, say, just a regular runny nose to something a lot more serious?
Now, the rash is really what is very characteristic of measles. Usually, when people develop that rash, that's when they know that this is something that is more than just a regular viral infection. But the problem is, measles can be transmissible up to 4 days before that rash begins. So, by the time people develop the rash, it may already be too late to avoid exposing other people.
And one more thing, I know a lot of people that we've been hearing from when we first started reporting about these cases that they're really worried about is whether, even if they are vaccinated, could they still potentially get measles. I know when the COVID-19 pandemic happened, everybody was saying that even though you are vaccinated, you may still get exposed, you may still get the virus. It's just not going to be as severe. For people, can you put their mind at ease and let them know if they have the measles vaccine, are they at a potential risk for still getting the virus?
Well, the measles vaccine, the MMR vaccine, so it covers against measles, mumps, and rubella, it's one of the most effective vaccines we have. So if you have had a single dose of this vaccine, you have an efficacy rate of about 93% protection against measles. If you've had 2 doses, which is what we recommend, it's between 97 to 98% protective. So if you have had your MMR series, if you have been vaccinated against measles and received both shots, it is almost certain that you will not get measles. It's a very effective vaccine.
And it really is one of the key ways you guys are recommending for people to kind of combat these recent cases we've been seeing. What are some of the other ways that we can do right now, before we let you go, Dr. Bagdasarian, just ways that we can kind of help mitigate the potential spread of the measles really here in the state of Michigan?
Well, I just want to again talk about vaccination and how important it is. If you have made the decision not to get vaccinated or not to vaccinate your children, this is a good time to rethink that decision, because measles is here and it is very, very transmissible. These particles can remain in the air for up to 2 hours, and you can in fact contract measles even if you haven't been in the same room as someone with measles. That's how transmissible it is. So this is a great time to check your vaccine records, talk to your healthcare provider, and make sure that you're up to date with vaccines. Now, it's possible that you've got kids and you made a decision to delay vaccines or not get them vaccinated some time ago, and you may not even remember. So please check those vaccine records and get vaccinated. Right now is a very good time to do that. The vaccine, in fact, is so effective that even after an exposure, up to 72 hours after an exposure, the vaccine can be protective. So getting vaccinated is number 1 key. Number 2, if you think that you may be at risk, so if you're someone who is unvaccinated, you're having symptoms that are concerning, if you think that you may have had an exposure to measles, please, before you see your healthcare provider, before you go to an urgent care or to your doctor's office, call ahead and let them know, because we want to make sure that we're avoiding exposures in waiting rooms. So please call ahead if you think there's any chance that you or your family member could have measles. And then the last part I want to say is, we're gearing up for spring and summer travel. And so if you are unvaccinated, we really recommend everyone gets vaccinated right now, but please get vaccinated before any international travel.
All right, this was all super duper helpful. Dr. Bagdasarian, thank you so much for taking time out of your day to stop by and really share all this information with us here on the live desk. We really do appreciate it.
Thanks for having me on.
Of course. And I want to thank everybody else for tuning into this latest edition of the Wood TV Live Desk. I'm Phil Pinarski, and we hope you have a great rest of your day.